Good afternoon, everybody. Might as well get started. My name is Sean Diver. I'm with Lonza, and I wanted to chat with you today about early intermediates and supply chain security, as the topic pertains to a lot of people in the world today. Just to kind of put a frame around what we want to talk about today, and there are some challenges around supply chain security that are in the non-GMP space of the API supply chain, and problems that we're seeing as an organization for either for ourselves or with our customers that we wanted to just kind of pose today and kind of talk through. We see an overdependence on the regional supply has caused issues of late, and so something that's coming up in the marketplace as a challenge. We've seen supply chain disruptions, quality inconsistencies. Certainly, we've seen rising costs in this spectrum and in this arena. But also, we want to kind of chat today a bit about people's concepts of nearshoring, this term that we've heard numerous times that we've engaged in ourselves as well, which is the idea of bringing your supply chains into regions or into closer to the API supply chain than may have traditionally been utilized over the last window of time. So to just take a step back and give you a perspective on what I'm calling an early intermediate, I know that Lonza is probably putting our own name on what this is, but essentially these are intermediates in pharmaceutical API supply chains. They are not, specifically not raw materials, specialty materials, commodity materials. They are downstream intermediates that just happen to not be GMP regulated. For the perspective of whether or not these are regulatory starting materials, they can be. I think that's a decision that people make from a regulatory point of view as to whether or not they're willing to allow non-GMP manufacturing to support regulatory starting materials. Many of our customers do. Some of our customers do not. They prefer to be more conservative and have regulated starting materials as GMP assets. We would not call things made under GMP an early intermediate in the context of this talk. So I'm going to spend a bit of time on this. A lot of this is anecdotal over my personal 30-year experience in the API supply chain and in a variety of different roles. And we're going to kind of look at it from what was happening over the course of time in the market, but then over the course of time as well as what's gone on with Lonza and where are we and how do we get to where we are today. And if we go back into the history of where intermediate manufacturing or custom manufacturing even began back into the 60s, the evolution of the fine chemical market space and the need for materials that are sourced externally from traditional pharmaceutical supply chains began kind of in this space in the 1960s. Before that, people were making their own plants from basic materials. And so fit-for-purpose plants were the design rage at the time. And portfolios started to get more complicated. More products are starting to get more or starting to get more approvals. So the need for specialty materials that are produced by third parties starts to come into play in the 1960s. And in that same window of time, Lonza actually implemented at our facility in Switzerland, we implemented a cracker. Right, so now as a raw material feed as an organization, we're working off of naphtha, we're cracking, and now the technology platform is rapidly expanding and we can go in a variety of different directions. That draws the attention of a lot of pharmaceutical manufacturing companies, and so the idea of an intermediate, I don't even know if these terms existed in that window of time, but certainly not GMP, non-GMP, but materials that are required as raw materials for downstream production for pharmaceutical companies came into play starting in the 1960s. That evolved. I certainly don't think that it was the most rapidly growing part of our industry at the time, but certainly in the early 80s, multi-step synthesis and design of facilities that weren't just fit for purpose were becoming much more attractive, and largely because the portfolio of APIs was growing rapidly. So we know that multipurpose processing is advancing at this stage in terms of facility design, and that there now becomes a greater dependence on specific materials, not raw materials, not commodity materials, but specific materials for early supply chains, for APIs, for innovative pharmaceutical companies. And that they're starting to reach out to external organizations. In the same window of time, Lonza built what's known as the fine chemical complex, and in 1984 we actually constructed the first multi-purpose processing facility specifically for the contract manufacturing arena. And here, I mean, almost entirely our portfolio were intermediates. So the idea in this window of time of what is GMP, what's not GMP, it's not the same as what we know it today. But this is where we were, and ultimately this facility is kind of like the grandfather of chemical manufacturing for the contract manufacturing space, and that's happening in that window of time. Regulatory begins to advance, GMP is evolving, quality systems are emerging far more rapidly, and through the course of the late 90s and early into the early 2000s, we know globally that our space expanded tremendously, and that the amount of capacity constructed dramatically increased. Vastly, that expansion of capacity occurred in Asia, and with that expansion and the excess capacity happening primarily India and China emerging at that time, there became a divide in the marketplace where non-GMP materials are emerging and downstream value is starting to be looked at much more closely in this window. Western producers started to engage much more closely with GMP manufacturing and let the non-GMP manufacturing go out east because the price game became very substantial, right? The price differential was very, very substantial at the time. So Western contract manufacturers started to de-emphasize in this window of time with capacity expansion. The Western manufacturers are de-emphasizing their non-GMP capabilities and maybe even shutting them down, investing more into GMP operations for advanced intermediates, things that require a DMF, things that require validation, or APIs. And then also relying on an external source of supply for what we're calling early intermediates coming from low-cost regions. In that window of time, Lonza wasn't a whole lot different. We started to focus and make investments on our downstream manufacturing and quality systems and GMP operations, in technologies that support more sophisticated molecules that are starting to come through the pipeline in this window of time. And we focused on our quality systems, really engaging and making sure that we're advancing ourselves in that space. So we even, for ourselves, in our own supply chains for our customers, engaged and embraced the fact that the price differential coming out of the different regions was advantageous, and we should not look at it, right? We should focus more on the things where we can add value. So that's through the 2000s and early 2000s or so, this has become a normal path. Early materials are coming from low-cost regions, and now what we're finding over the last couple of years, you may have seen in the press, or you may have seen in your own supply chains, that there's differences today than there were maybe 5 years ago, where we see inconsistencies in either quality systems or supply of some of these materials coming out of the region, and that costs are also rising substantially. So that supply-demand balance or the value that was being captured was driven very substantially by price in the past, is now suddenly not as driven by price. And so what's the new definition of value? What's the new definition of security of supply? So we also know that there have been a lot of plant closures, so the spare capacity, the excess capacity is dwindling down, and the value chain and the total cost of ownership concept is making its way further back into supply chains. It's happening in the marketplace today. So for Lonza, what's happening in the same window of time is we also need supply chain security. So we looked into our own assets. We still have non-GMP manufacturing capabilities that are appropriate, that have appropriate quality systems for pharmaceutical manufacturing. They support multiple markets, but they are appropriate for pharma manufacturing. And if we've got them, why aren't we using them better, more effectively, and really creating value, with security of supply being the driver? What's the definition of value today is different than what the definition of value was a few years ago. And through the course of those actions, if we're solving problems for ourselves, well, we certainly can solve problems for our customers and offer up this opportunity to provide materials directly to the marketplace as well. So we do have multi-purpose processing facilities that are operated under ISO conditions, and we have improved cost of goods and security of supply for ourselves and for our customers with this program, with this early intermediates program that we've got in place. So the other thing I think that it engages, it allows our customers to engage a little bit further along the supply chain. If we want to go back a little bit further, we've got another opportunity to offer folks. And if we can do it, we should do it. So some of the Lonza stuff I'm going to feed in here along with the stuff that's happening in the marketplace. It's selfishly plugging us, but there we go. So why Lonza? Why would we pick us? There are, maybe others. In the Western space, I think we are one of the few that maintain non-GMP manufacturing assets, especially at the kind of scale that we have. What makes us different is we've been doing it for 40 years. 100 years in the overall chemical industry. Huge amount of exposure to different commercial products and development products that have come through our shop, and so this experience base that we have and the staff of people that we have is lendable to the non-GMP space just as well as it is to the GMP space from a portfolio point of view. We think it increases the flexibility for our customers. They have the ability to say, if they only need an early intermediate, that's great. If they need a downstream intermediate or an API or drug product or particle engineered materials, we can offer that as well. But the flexibility to bring in this program just gives more options to the marketplace. And I think that the marketplace has been very receptive to the conversation. The fact that it's even being offered coming out of the West is something that has raised a lot of eyebrows for us, which has been nice to hear. Finally, I think we talk about location, but specifically coming out of Switzerland, I think that our assets are being centrally located in the West really helps people with this concept of nearshoring that we talked about before, or that I brought up before. We've heard from a lot of folks in the industry that say, if I'm gonna redo my supply chain and my sources of supply, then I need to think about where do the materials need to go, and I want to bring everything a little bit tighter together, and I don't want to have to pull materials from across the globe. Having things a little bit closer together is more advantageous. Being located in Switzerland has been well received, I think, in those conversations, because we're not ever so far away from any one region. So it's been helpful. All right, and then I think an enhanced value we've kind of touched on already. It's enhancing the supply chain capabilities. Our quality and compliance programs are top tier, and we have a staff of people that are extremely experienced. And quite frankly, I think we're large enough that we can talk with anybody about whatever business arrangements that they may need. We could be flexible with business models. This doesn't have to be tactical transactions. We can actually work in a variety of different ways. So just to kind of dig in a little bit about where we do this, well, let's touch base quickly about Lonza, Pharma, and Biotech and where we operate. So we operate out of 3 regions. We are ourselves in Asia, Europe, and North America. We're specifically talking about Visp, Switzerland today, which is kind of the epicenter of chemistry for Lonza. The other API manufacturing we have is in Nanjing, China. But the other facilities with Bend, Oregon, Quakertown, PA, Tampa, Florida are drug product and particle engineering locations, and then as well with Edinburgh, Ploermel, France, and Montenegro, Switzerland, other capabilities. But API Switzerland is in Visp and in Nanjing. And just quickly talking, I'm not going to go through everything, just as a topically, we cover API, bioavailability enhancement, modified and targeted release, inhalation and encapsulation in technology pillars. But again, we're only talking about customized API today, and the early intermediates are part of it, just part of that API, overall API offering. All right, so just talking about the assets and where we do this. These are facilities that are in place is supporting late stage and commercial manufacturing for the most part. These aren't facilities where if you need 10 kilos of something for phase 1, they're not necessarily fit for that. What I'm focused more on are the long-term supply, the late stage clinicals and long-term supply of the intermediates. They're coming out of equipment. We have 7 plants that are pharma appropriate with their quality systems that operate under ISO conditions. And that gives us over 600 cubic meters of reactor capacity with a variety of technologies that come with Lonza capabilities, including isolation capabilities and drying. Right, and just so that you know, as a program, part of our mission is to just make sure that you know that we're here doing this. If you were probably walking down the street saying, I'm not sure that I would think of Lonza in this context. But we are here to do non-GMP intermediates, and we're looking to be a partner to our customers for their entire supply chain, including them. All right, so from a program point of view, how is this valuable? There are 3 ways that we're taking a look at how we bring value to either ourselves to our customers, right? And the first we call value chain, and this is essentially back integration. So if we have either our advanced intermediates or APIs that are being sold to our customers, or our APIs being sold into drug product which are being sold to our customers, this is us saying, if we go back and manufacture these intermediates ourselves, we'll enhance either through an increased security of supply, reduction of risk, reduction of cost, all of those things, secondary source of supply. This is what we call value chain. And I can talk about an example. I don't have a slide of it, but I can talk about an example of what we're doing in value chain. We're participated recently, although we're in a lot, with a fast-track molecule that made its way through very quickly and is through the approval process. And a high-value product needed to get out into the marketplace quickly. So the supply chain considerations came to Lonza pre-baked, and we got it in, put through, qualified, it's out into the marketplace. And now what we're doing is taking the time to say it's time to be cost effective, it's time to optimize. So we're utilizing our program here to say, well, what is it that we can do to, 1, reduce costs, which we've done substantially, but 2, also reduce the security of supply. So just even from a planning point of view, we reduced our lead times. We're able to take long-term planning on the ultimate product and feed it back into our plants, create flexibility, but also possibly even inventory. We can build in those strategies by ourselves. So we're saving on time, we're saving on money. We're also optimizing those processes, so we're getting efficiencies downstream as well. So with just one product alone, we have 3 intermediates that can now be considered for this program. The risk is reduced. We now have multiple sources of supply, and it's bringing a whole lot of value to the customer, and they're very, very, very happy with that program. So, that's one. It's a little less visible for what a direct customer may want to look for. The second stream and the third stream are our revenue generating stream. So if a customer were to come to us and say, listen, we would like an intermediate from you, it could be just a custom intermediate for an innovative molecule that's in the space by itself today. But we also see a need for intermediates that may be already genericized APIs. And so those intermediates may go into a variety of different customers. The same product or similar intermediate that might go into a similar product. Let me give you an example. Because we're back integrated, and sorry, just a quick second. These are specifically what we call Stream 2, this platform stream, are the intermediates that come based on Lonza chemistry, right? So where are we back integrated, and where do we have raw materials that are already available to us commercially in the marketplace? So if we take a look for a quick second, we have a cracker. We ultimately, break through, come through, and we have the chloroacetoacetates as a feed stream coming out of our general operations from Lonza, right? So if we look at the chloroacetoacetates, what might they feed? And what's really interesting about these intermediates, these are cephalosporin side chains. And if we all know right now that bacterial resistance of antibiotics is a big issue, right? And the cephalosporins are not only are they short in the market, but they're on the uptick of being used because bacterial resistance is something that's it's causing angst around what are being used. So from the chloroacetoacetates, there are a cadre of intermediates that can be derived from that base stock, right? And alone, if we look at, the ATA, the ATHA ester, the ATMA, the MAM, all these intermediates are side chains for the cephalosporins, and ultimately they feed 8 different cephalosporins. So this back integration can not only just be one-on-one, but it can feed the industry, right? So that's the purpose of why the revenue stream for Value Stream 2 is important, and why we're utilizing Lonza chemistry in order to make sure that these intermediates become available. Just flicking back for a quick second, I'm sorry. In the third and the second revenue stream, but the third line that we have for value are when those customers need to come to us directly. They do not need to have a raw material base that's sourced, that comes from Lonza directly. We can work on custom manufactured intermediates as well. So the same way that we receive advanced intermediates or APIs, we can also do non-GMP intermediates. All right, so just a quick summary on this one, and then just make sure I'll check my time. We think that by enhancing the supply chain and going backwards, we're answering a gap that exists in the marketplace today that's emerging around the security of supply. It addresses the increases in pricing that we're starting to see out of that marketplace. And we offer an alternative for our customers to have more services available to them should they choose to embrace them. Again, we have business models that we can work with that fit the need of what the customer may require. Right, and so we view, just as a visual, the chain that's there, the bridge between the specialty materials and the raw materials and the GMP world is an important one, right? These are definitely intermediates that are only really used in the pharma space. They're under quality systems that are critical, that they could be applied in a pharmaceutical manner. So we really feel like it's the key to unlocking total cost of ownership enhancement and value enhancement for the supply chain. All right, so that's my quick little talk. If anybody has any questions, please let me know.